Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 4 new cases of COVID-19 in Windsor and Essex County. 3 are close contacts of confirmed cases and 1 is community acquired. We've had 16,757 cases since the beginning of the pandemic. 56 people are active at this time and 25 of our active cases have a variant of concern. To date, 1,932 preliminary or confirmed variants have been identified in Windsor-Essex County. 7 people are currently in the hospital and 2 people are in ICU. Our community has lost 433 people to COVID. There are currently 3 active outbreaks in Windsor and Essex County, 2 workplaces and 1 community outbreak. Regarding our vaccination update, 369,038 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 267,326 people have received at least 1 dose. So overall, 73.1% of our adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. 29.2% of our adults 18 years of age and older are fully vaccinated with 2 doses. Residents of Windsor-Essex, 12 years of age and older, are able to book their vaccine appointment for a first dose at any one of our mass vaccination sites. Seniors, 70 years of age and older, are able to book their second dose. And beginning tomorrow at 8 a.m., residents of Windsor-Essex County who received their first dose of an mRNA vaccine on or before May 9th will be able to book their second dose at one of our mass vaccination clinics. For those who received their first dose of an AstraZeneca vaccine 8 weeks ago and would like an mRNA as a second dose can book their second dose in our booking system. Your second dose must be at least 8 weeks from your first dose. To book an appointment, please visit wevax.ca or call 226-773-2200. Before I turn it over to Dr. Ahmed, I'd like to wish him and all the fathers a very happy and safe Father's Day weekend. We will be sending out further messaging, but essentially we would like you to stay safe by staying local, gathering with your household members only, connecting with loved ones virtually, and keeping a physical distance of 2 meters from people you do not live with. If you are planning a gathering with others outdoors, ensure no one has symptoms of COVID-19 and everyone is maintaining a 2-meter distance with no more than 10 people. Gathering indoors with people from outside your household, visiting other households, and traveling outside of Windsor-Essex County are still considered high-risk activities that should be avoided. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Thanks, Teresa, for the Father's Day wishes. A couple of updates before we go into our EPI summary and some of the new eligibility that Teresa already mentioned with respect to vaccine clinic. So more people will be eligible to receive their vaccine starting tomorrow in Windsor-Essex and then the rest of the province starting on Monday. We also heard a stronger messaging and recommendation from the National Advisory Committee on Immunization regarding mixing of COVID-19 vaccine. And some of the key takeaways are, number 1, take the first vaccine that's available to us. And we have been saying it all along. And of course, we want to beat this pandemic. We want to make sure that we are staying ahead of this pandemic by ensuring that our community is protected and there is no ongoing transmission. The safety and effectiveness of these vaccines have been studied very well in other parts of the world, especially in the UK that have been mixing and matching these vaccines for months now. So this is not a new concept, even for the COVID-19 vaccine. So it's been happening everywhere, which is further reinforced and endorsed by the National Advisory Committee on Immunization yesterday. For those who have received their first dose of AZ, NACI updated their recommendation as a preferential recommendation for them to receive the second dose of an mRNA vaccine. And again, this is based on all evolving science, and we can always take this analogy as when you have a better treatment option for a disease, we always recommend that. But again, that doesn't mean that people cannot continue on taking the second dose. It has nothing to do with the vaccine supply or vaccine availability. It is more on what is best for the people, and we will continue to find what is best for the people and continue to update the science as we continue to learn more and more about this. For those who have received their full completed series or 2 doses of AstraZeneca vaccine, they don't need any additional dose. So let's just be clear. So those who have completed the series, there is no recommendation to change or to add an extra dose for them for any reason. They should be considered fully protected, and there is no reason for them to get worried that they need an extra dose of mRNA vaccine. So we have good data again from from England, where we have shown that even 2 doses of fully protected individuals with AstraZeneca, even they're protected, the vaccine is effective at least 82 to 84% against the Delta variant. So we are doing pretty good in terms of our vaccine rollout in our community, and with the evolving science, we'll continue to share all of those information with the public. So no need to be concerned about any additional doses if you're already fully protected with the AstraZeneca vaccine. On another note, I heard some people are concerned about mixing and matching a vaccine and then whether they will be allowed to enter US or some other places in the world. I just want to tell them that there is no need to be concerned. There is no need to be panic around this time. Travel is already closed. These conversations are already happening at the higher level. I cannot imagine a world where people will be restricted by the type of vaccine that they have received. All these vaccines, we in Canada or in Ontario are accepting vaccine that is WHO approved vaccine for people who are returning to Canada. And those are the WHO approved vaccine that includes AstraZeneca as well as all these mRNA vaccines. So rest assured that things will continue to update when the borders and when the travel will open. I don't see any reason for people to panic or get concerned that their vaccination, if they have received, there will be any concerns about that. It may come at a time where maybe it's tied with all the travel and all those related issues. So at this time, there is no travel happening regardless. So please be patient and no need to panic, because this happens all the time. Again, same idea. There's no reason for people to get panicked that their vaccine will not be accepted in the US or in any other parts of the world. So now I'll move on to our epi summary. All right, so giving you a quick look on the number of cases in Ontario, daily new cases and 7-day average. We see continued decline in the province, and there were some days when we have seen less than 300 cases of COVID-19 cases in the province. So we are moving in the right direction as a province, and focusing further in our region, Windsor-Essex, we continue to see an ongoing decline in our number of cases as well, which is pretty evident in this graph, and we continue to see that decline. Looking at putting both these pictures together in one slide, similar trends, a huge increase with respect to the third wave in the province, mild increase in our region, and then a significant decline and continued decline of cases in our community. Looking at our week-to-week case rates per 100,000 population, what we see is our most recent completed week's case rate is 14.8 cases per 100,000 population. And again, this has decreased from the last week. And just looking at the past 7 days, our rate is 13.2 cases per 100,000 population. And again, all these indicators are consistently going down, moving in the right direction, showing the progress that we have made with our public health measures, as well as our high vaccination rate as we continue to report. Our comparison for our cases with the province as well as the southwestern Ontario, we're all all the cases are declining everywhere, and we are doing pretty good from that respect. So this is the wastewater surveillance data, and in the past week we have seen that the cases are it aligns pretty well with the cases that we are seeing in the community, with minor fluctuation, which really doesn't necessarily translate much into any meaningful data. Obviously it is dependent on a number of variables, and it is still a research study at this time, so the data continues to be validated, but overall it aligns well, showing that overall our community picture is exactly what we are seeing with respect to our cases, so which is definitely a good sign for our community. Another indicator that we look at is the percent positivity of all the tests that are being conducted in the region. And in total, since the beginning of this pandemic, we have conducted we have tested more than 362,000 tests in the region for COVID-19. And just the last week, we conducted 4,050 tests in our region with a percent positivity that is around 2%. Again, this is a decrease from the last week, which is 3%, and have percent positivity of 2% is also showing the indicator that the cases are declining in our region. Looking at just the last 7 days with respect to percent positivity in Ontario, there are regions that continues to have a higher percent positivity, and Windsor-Essex is slightly above the provincial average, but overall, when we're looking at the actual case counts, it is very well, and this percent positivity shouldn't be seen as an isolated indicator to see the success of where a region is. From an age distribution perspective, all of the age bands except for the 0 to 17, we continue to see a lower percent positivity, and even in the 0 to 17, the percent positivity is decreasing, again, which is mainly because of many of these individuals in the 0 to 17 age group are either not eligible for the vaccine or have a lower vaccine coverage rate. We know between 12 to 17 years, our vaccine coverage rate is roughly around 40 or 42%, and that definitely needs to be increased in order to provide the full benefit of the vaccine to our community and reducing the transmission. And as we continue to talk about the school reopening in fall, it is important that we have a higher vaccination rate in the 12 to 17 years of age group, so the school, these children can safely go to the school without any risk for COVID transmission. With respect to the cumulative regional and provincial rate, we continue to be at number 4 in the province with the highest regional rate, and majority of these cases are from the first and the second wave, and not necessarily from the third wave, as I just mentioned. So our first and second wave impact has been significant enough that continues to keep us at that position. But clearly, in the last 3 to 4 months, we have done an excellent job in keeping our case rates down with all the measures and with the vaccination program that continues to bring the benefit in our community with the disease transmission. Breaking it down in terms of regional rates into each of these municipal rates. So Windsor continues to have the highest rate in the region, followed by the rest of the municipality with minor variation, and that continues to change on an ongoing basis. So this data is from June to present, which is basically 18 days worth of data. Looking at the distribution of cases, where these cases are in the last 30 days, starting from May 17, similar picture. Windsor continues to have almost like 3/4 of all the cases in the region, which is again disproportional to the population that lives in our community. Some of the reason obviously is the majority of the businesses, majority of the people who live in here in a high density area, and potentially continuing to lead to ongoing transmission. But the rest of the municipalities, with minor fluctuation, they're pretty much similar in terms of the distribution of cases. Just in the last 7 days, similar picture, and with minor fluctuation, as I mentioned, on and off between one municipality and the other. With respect to age and sex distribution of all these cases, we are starting to see some stabilization of these effects other than the 0 to 19 years, which is again reflecting that that's the population who has just become eligible, or some of these population just become eligible for the vaccine, and still 12 years and under are not eligible to receive the vaccine, and that's why the burden of cases are coming from here. And again, it's also an indicator of how effective these vaccines are with respect to preventing the severity of the disease and limiting the ongoing transmission in our community. All the age bands that have already received the vaccine, we are seeing that the cases in that age band are declining, and the age band that is not eligible to receive the vaccine or has a lower coverage of vaccine, those age band continue to show that there are cases happening in that age band. From an exposure perspective, not much different. The effect obviously is getting reduced based on the number of cases that we are seeing, but typically it still includes the community spread, which is in the red, and then the household contact and close contacts, and the rest of the related to outbreak and travel. Source of acquisition, if we're looking at it from a proportion perspective, 38% coming from the household contact and almost 37% coming from the community, which is again still something that important to remind people that when you are going out, there is at least 1/3 of our population are contracting COVID that way. So even though the cases are limited, you still need to make sure that you continue to take precautions if you're outside, because you never know who is sick and who can potentially transmit that COVID-19 virus to you. From a VOC perspective, where we are is anywhere between 60 to 80% that has been our norm, and obviously we are the data is sometimes delayed, so the last few days worth of data may not be as accurate as we want it to be, but just to give you a sense that basically the variant of concerns are the dominant strain, if you want to call them, and then the typical non-variant of concerns are the original SARS-CoV-2 virus still continue to be exist in our community. Hospitalization picture in Ontario and Windsor-Essex, both declining. The province is shown in green line, and the blue line represent Windsor-Essex, so moving in the right direction. Similar picture with respect to ICU utilization, both moving in the right direction with less and less cases of COVID-19 in the hospital and in the ICU. From a case doubling perspective, as we can see, the line is creeping up again, which is a good sign. So anytime in this particular graph, when we are seeing that the line is going up, that means we are doing better. And if you're looking, Ontario, Canada, and our region continue to increase our case doubling time, meaning we are doing better. And we can clearly see that we are not only doing better, we are doing better than what is happening in Canada, what is happening in Ontario. So from a median R0 effective perspective, what we are looking at is, again, the reproductive rate. And the most recent estimated R0 is 0.7. And this is, again, decreased from the last week when it was 0.84. So basically, as we have explained before, if the R0 is less than 1 consistently, that means our case rates are going down consistently in our region. So we hope that if the trend continues, we'll continue to see less and less cases in the community. And as today Teresa mentioned, our active cases are now in the 50s, which is really great, and I think probably one of the lowest active case numbers that we have seen. Thanks to the community for following the measures, which is critical, and then also thanks to the people who have rolled up their sleeves to get the vaccine in our region. Despite the vaccine rollout, as we continue to say, please follow the public health measures until we get to the point where we are no longer seeing an ongoing transmission in the community. So please continue to follow that. Now, update on the vaccine rollout, and as we can see, a global picture of where what we are seeing with regard to people who have received at least one dose of COVID-19 in the vaccine in the world. And among the leading countries with high vaccination rate, Canada has now surpassed all of the other leading countries, and now our case rates are even, our proportion of people who have received at least one dose of COVID-19 vaccine is even higher than the Israel, which is always considered as the country with a higher vaccination rate. So the pace was slow to begin with in Canada, but now we have caught up with a strong vaccine rollouts program in Canada, in the province, and locally. We were able to beat all the other countries in terms of getting to the a higher vaccination rate. And again, we may not realize it, living inside Canada, that what we are seeing and experiencing and how we are comparing with the rest of the countries, you can see all kind of noise and all kind of information. But our vaccine rollout, our response to COVID-19 has been one of the best in the world. Regarding the second dose of COVID-19, so again, some of these countries are there. Canada is still a little slow in terms of getting having the full share of fully vaccinated people, but we are catching up. We are looking at Canada is climbing having a very steep climb. And even in our region, we are already close to 29.4% of our adults fully vaccinated. That's almost 1/3 of our population that's fully vaccinated. And we are on track that if we continue on with that trend, we may be able to achieve the fully vaccinated people, 70% that we have right now in adults, maybe by the end of the month of July. So we are on track. We are on the right track for the full 2-dose summer, and we need all your support to make sure that we continue to vaccinate our people and keep our community safe. So now looking locally at the data, so what we are looking at is the number of vaccine that is being administered in Windsor-Essex. And as you can see, the graph, it basically just shows this ongoing increase in the number of daily doses that are given out in the region. And the blue shade indicate the first doses, and the green shade indicates the second doses. What we are looking at is roughly around 10% of the doses that are given out are first doses, and then almost 90% of the doses that we are seeing, at least in the last 7 days, are the second doses. So we are making significant progress in terms of protecting our community with full vaccination. And if we break it down further in terms of what the average looks like, so we are hitting 7,000 doses a day. 7,000 doses a day for a region of our size is pretty significant in terms of what the resources we have as a region, and from a population level perspective. This can only be achieved when we use our vaccine rollout model locally, including all our mass vaccination sites, our pharmacies, our primary care providers, our hospital partners. The municipalities really helped us to give out these vaccines, and along with all the partnership that were in place, we are able to hit 7,000 doses a day now with a daily average of 5,400 doses a day. So almost more than 5,000 doses a day are being given, even on the days when we're looking at it based on a 7-day average, because we know some days, especially over the weekend, the uptake is slow. So looking at the cumulative doses that's administered to Windsor-Essex, so we can see, and basically this graph basically tells you that how steep the curve is and now how it's plateauing for the first doses, which is again in the blue shade, and then the green shade is basically showing how the second doses are picking up and the curve is getting steep, and that would allow us to vaccinate our people in the next month or so, and we'll be in a much better position before we move into the fall of this year. From a age distribution perspective, overall, and again, 60.9% is our coverage overall, and that includes even the little kids who are not even eligible. So if you're looking at that data, we're still already at 61 or 60.9%. And then if we are looking at all those who are eligible, which is 12 plus, and then at that our coverage rate goes up to 70.5%. And then if you're only targeting the 18 plus, which is 72.9%, and the reason that we put 18 plus is that's usually the comparator that we use when we are comparing our rates with the rest of the world. And that's where we are at with at least 1 doses. And among the different age bands, obviously the highest age group, they have a highest coverage, and we can see the gradient effect with as the younger age comes in, the coverage starts to decrease. So not an excuse for people in the younger age band to not to get the vaccine. Please, we need a high vaccination coverage rate to keep our community going, to keep our economy going. We need that. So anyone who is still contemplating receiving their first dose of the vaccine, please get it. To make sure that you continue to do your part and to keep your community and also your family protected. Even in 1 or 2 individuals who are not protected in your family could have an impact on COVID-19 transmission inside your family and can potentially pose more risk for the rest of the people. So this graph basically shows that how we are like the difference in terms of the uptake in each of these bands, and as we can see, the higher age bands, we're seeing a plateauing of the effect because mainly we have covered all those population for the most part, 95%, more than 90% coverage, which is really great, but in the younger age band, there is still a lot of room for improvement, and more importantly, 12 to 17 years. I understand we have done some sessions, and there is a session that I did with the school board, in partnership with the school board, talk about the vaccine issues, specifically for the younger people. If you haven't seen that YouTube session, please watch that. It may help to get you the answer that you're looking for your children. We need to make sure that we are taking all these everyone with us and protect them. We also know that there's ongoing research that's been happening for children who are younger than 12 years to get them the vaccine. So by fall, we may have these vaccines available for even children younger than 12. So please do your part and make sure that you're protecting yourself and everyone else. So now, people who are fully vaccinated with 2 doses, our overall coverage, and again, it's based on the data 2 days ago. Overall coverage 21.8%, with 18 plus coverage 27.4%, which has, as Teresa mentioned this morning, it is now up to 29.4%. So really, we're making huge progress with our vaccine coverage. And as we can see, the rest of the age bands, we are seeing a gradient effect, but with more and more openings up, more and more people becoming eligible tomorrow, we'll continue to see that the number and proportion increase. Similar graph showing the plateauing effect and how quickly we have vaccinated the 80 plus and the 70 plus, and you can see how steep the curve is. We'd like to see that curve going up for all of these age bands. So from a hotspot perspective, overall our coverage, as I mentioned, 60.9%. Hotspot coverage is slightly less than that, but clearly some of the regions are doing better than the others. Some of the regions need more work to get people vaccinated. And again, this graph shows people who are fully vaccinated within the hotspot. Again, some regions can do better, especially when we're looking at N9A, N9B, and N9C. And some regions are doing better than compared to even the overall average. So the doses, the vaccines are being administered in the hospital-based clinic, public health clinic, and the pharmacy. It really helped us to move the vaccines in our region. The majority of the vaccine that we have given out is Pfizer-BioNTech, followed by Moderna and AstraZeneca. From a proportion perspective, 15% each for Moderna and AstraZeneca, and 70% for Pfizer vaccine. Just another way to look at it in terms of the breakdown. So majority of the vaccine we continue to give is Pfizer-BioNTech. So this is a new graph which basically shows the vaccine coverage rate for the 18 plus versus the COVID-19 cases using a 7-day average. And as we can see that the moment when we are starting to increase the coverage rate with 2 doses and then 1 doses in all of these age band, our case rates continue to start to go decline, showing the benefit and the importance of vaccination. And if that trend continues, hopefully we should call the pandemic over and we can all go back to what we like to do. So in summary, the case rate continued to decline in our region consistently, which is really important, that it's not just one-time event. There has been some consistent decline. Hospitalization and ICU have been declining overall, not only in our region, but also in the province. The case rate aligns well with the wastewater surveillance data and continues to remain low. Our overall coverage rate continues to increase even for first dose as well as second dose in our community. From a monitoring indicator perspective, our most recent completed weekly case rate is 14.8, but just looking at the last 7 days, it's 13.2 cases. Our person positivity continues to decline, which is 2%, and our most recent person positivity is 2.7%. Our R effective is 0.7, again showing that the new cases are declining in our community. Our outbreaks are declining in the community. Right now we only have 3 outbreaks in the region, and that includes all of the workplaces as well as community outbreak, and we've got a pretty good coverage rate with at least 1 dose, 73.1%, and 29.2% of Windsor-Essex adults are fully vaccinated. Thank you.
We'll now take questions from the media. Today we'll start with AM 800.
Good morning, Dr. Ahmed. I know you touched on at the very beginning before your epi summary about the people who received AstraZeneca not needing an extra dose of something. We have actually received plenty of emails from people asking if they've received 2 doses of AstraZeneca, will they need some sort of top up or third dose? And I know that, third doses for everybody is something that was discussed a while back. So I guess just what is the message on that now?
So the message continues to be the same. So those who have received 2 full doses of AstraZeneca, they are considered completely fully protected. They don't need any additional dose. Their body has enough immune response that would protect them from COVID. So there is no need to be concerned about it at all. And even with the latest vaccine effectiveness data coming out from UK that has more than 80% of their population vaccinated with AstraZeneca, the AstraZeneca vaccine is even protective for the Delta variant. The only changes in the recommendation, obviously, it comes based on the evolving science and then the risk and benefit of each of these vaccines. So at this time, those who have received 2 doses, they don't need any extra booster or anything. And just as a word of caution, as we've talked about it, even in the previous recommendation for people who have received their first dose of AstraZeneca, and if they're getting a second dose as an mRNA, there may be slight local reaction, which could be more than what they have received in the past. So having said that, it doesn't mean that they shouldn't take it. The preferential recommendation from NACI is those who have received the first dose of AstraZeneca, they should get a second dose of an mRNA just for a better immune response. And again, it's based on the better treatment option that is available. It has nothing to do with any kind of harm to anyone. It's better. So that's why we make that recommendation.
Okay, thank you.
Any questions from CTV?
Yes, you just touched on this earlier, but we do know that, for example, Canadians who receive the AstraZeneca, they won't be allowed to attend the Bruce Springsteen Broadway show in the States. And I know you said things are continuously updating. Again, what message do you have for the public, especially here in Windsor-Essex, who go over the border all the time? And are concerned that they might not be able to partake in events like this? So
first of all, I would just want to reiterate that the borders are still closed and there is no travel happening. And we're talking about an isolated event, and the event organizer, they can have any kind of requirements that they choose, and again, unless they're not allowed under the law, and I don't know how the law works in US, but this is based on an isolated event that we are talking about. When we are talking about a global travel restrictions or who is allowed to travel, it's a much bigger issue, and it needs to be addressed at that higher level, and those discussions are happening constantly. We have heard many discussions about what's next for people who are fully vaccinated. Can they travel? Some of these travel restrictions are easing up in UK or in Europe, where people who are fully vaccinated can now go from one country to another without the need for quarantine. So a similar mechanism is being looked at for North America and for people who are living in US and Canada, and what their travel restrictions would look like. So I want to just say that, for those who know the world policy and how all of these decisions are made, what's the role of international health regulation, WHO, these are all there to protect the interest of the entire world, not just for one country. So it will eventually change, and it may not move as quickly as some people are expecting. But again, what you're referencing is one isolated event, and not necessarily an entire policy that would shape in the coming weeks or months.
Okay, thank you. For this next question, sorry if you've answered this in the past, but for children who are younger than 12, should they be getting the vaccine? If so, what's the rollout plan? What are we looking at this point?
So as I mentioned that there is ongoing research that's been happening in the younger age band for children who are younger than 12. We may see some clinical trial data emerging in fall of 2021. And once that data emerges, we will see what it looks like, whether it would be a reduced dose, whether it would be multiple dose or a single dose would be sufficient. So we'll be looking at all of that data. And then the vaccine rollout plan, it would pretty much, I anticipate, that would be tied with the other type of vaccination program that already exists for children in the primary care provider's office, pharmacies, and other places that are there. I don't see that we will continue to operate the mass vaccination clinic when we have 70% or 60 to 70% of our community fully vaccinated. So mass vaccination clinic obviously will be gone. And the options would be, which is a better option, is to work through your primary care provider to get your vaccine. And in some cases for adults, obviously the pharmacy provides much more flexibility in terms of how you get the vaccine.
Okay, and we did have someone reach out to us claiming that they were diagnosed with, I'm going to pronounce this wrong, myocarditis due to the mRNA vaccine. And I do understand that this is very rare. What are some of the symptoms that people should be looking for, or what could you tell us about this at all, if anything?
Yeah, so myocarditis, it's as you rightly identified, it's a rare event that has been noted with some of these mRNA vaccine, and it's currently being studied, and it is seen especially after the second dose, and again the population level impact for this myocarditis, which is basically an inflammation of the heart muscles. It can happen after any kind of viral illness. So it, again, just understanding the potential impact of this post-vaccination is still not clear, that how the mechanism is happening. So if and in all of the cases, these myocarditis was treated with simple treatment, and it helped without leading to any severe consequences. So all these symptoms are mild and very with no a severe outcome. So people who are considering, again, a lot of these younger children in that age band, they can develop myocarditis even without any exposure to the vaccine. After the vaccine, there is a slight concern that this is possible. So again, in sharing how the science evolves and how these data are coming out. But overall, with the amount of vaccine that have been given out throughout the world, we will continue to look at the data, and we'll continue to update our recommendation at this time. None of the regulatory authority in any parts of the world has said anything to limit these vaccines in the younger population based on the risk of myocarditis in the younger children. So we'll continue to update, but at this time, it's something that if you're having some mild flu-like illness, and if you're having any kind of chest pain, those are some of the things that you may want to follow up with the doctors. As I said, those are mild and were treated very easily with your doctors without any severe consequences that has been noted in the world.
Okay, great. Yeah, you mentioned the chest pain, and I know that you mentioned that a lot of these symptoms are mild. So aside from the chest pain, is there anything else that, like everyone's going to assume that there's a possibility of having a side effect from the vaccine, right? So just any other tips or anything else people should watch out for, that they should realize, okay, wait, this isn't just a regular reaction, like this is something I do have to go see my doctor for, just so people can know that differentiation?
Well, I think what we always say is, so you have to look at the different types of potential reactions to the vaccine. So every time when you're receiving the vaccine, the way our body reacts, we say that's why stay for 15 minutes after you receive the vaccine. So that's the most critical timeline, because that's the time if there is any kind of allergic reaction that needs to happen, an anaphylactic type reaction that needs to happen, it happens in either within the 10 minutes, so 15 minutes again is a little bit more than what you normally would need. So that's the immediate reaction. And then once you receive the vaccine, you go home, and for the next few days, you may expect more reactions such as the injection site pain, fever, mild flu-like illness, and maybe a swelling around where you received the vaccine. Those are all common and normal reaction to the vaccine, basically just telling that your body is trying to build that immune response in your system. So those are, again, all these symptoms are generally go away, and it starts to show improvement within 24 to 48 hours. And if it doesn't improve, that's your cue that, you know, maybe something more that you need to get assessed by a healthcare provider. If the symptoms are unusual, which you have never experienced before or which we haven't talked about, again, that is also your cue to maybe connect with your healthcare provider to know more what is going on. A lot of these vaccine related events, when people are thinking, it could be just what we say is coincidental rather than having a direct impact of receiving a vaccine and then your body reacting differently. That happens very rarely, and most of those are allergic reaction, and more severe systemic allergic reaction are still rare but possible, which can result in generalized rash or something like myocarditis, as we are talking about, which again it would mean that, you know, people can start to feel heart palpitation or start to feel again weakness and chest pain. So those are some of the things that you need to be mindful of. Myocarditis can happen after receiving the vaccine second dose. That's what they're finding most common after the second dose. But even still, after 7 to 14 days, they can have those symptoms. So if you are concerned about that, you go and you talk to your doctor. Anything unusual that you are experiencing, obviously you want to talk to your doctors. Immediate reaction, as I mentioned, the most common ones are the pain, swelling, mild flu-like illness, which is common. Anything unusual, always connect with your doctor.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I appreciate that NACI has an advisory function and doesn't set policy, but do you think that given this announcement and previous ones, we'll eventually stop seeing supply of AstraZeneca here locally and in Ontario?
I don't think so. And I think their recommendation, NACI never make recommendation based on the policy direction or any concern. If we say that this particular vaccine is not available, what are our options? Maybe they can provide their scientific recommendation based on, is it possible to use that option or not? But right now, the recommendation that they made, it has nothing to do with the supply issue. It has to do with the evolving science and what is better for our community and how we can do that. So I think it shouldn't be confused that this is based on the supply issue. It's rather based on science, and then the supply issue is something different that we'll have to deal with the province and see whether supplies are there or not there. We continue to provide the vaccine that we received, even AstraZeneca as the second dose that comes in our region.
Thank you. And switching gears entirely, we have 3 beaches closed right now due to E. coli. Is that unusual?
I'll take the beach question. So it hasn't been unusual in the past. It really is dependent. It's a testing at a point in time. So any of the beaches that have exceed the E. coli level, which is 1,000, they are retested on Thursday. So that would have been yesterday, and we will get repeat results sometime today. And if there is the ability to change that posting, meaning, you know, reopen it or post it as a caution and not a closure, then we would be able to notify the public of that. So it's not unusual. We did not do beach testing at our health unit last year based on the increased needs of the pandemic. So, but in previous years, that did occur. And as Dr. Ahmed had said earlier in the week, that The beach testing is just at that point in time. And so conditions, weather, changes, and that all changes the results.
Thank you. So is anything below 1,000 acceptable? Is that the threshold or is it lower?
1,000 would be to close a beach, and what we're looking at is lower than 200 is the magic number. But anything above 200 would be posted as precautionary. Like if the beach isn't closed, but it's like these levels are elevated, don't swim in the beach.
Thank you very much.
Any questions from CFTV?
No, thank you.
Any questions from Blackburn?
Yes, good morning. Do you have an idea of the number of people who will become eligible tomorrow to register for the second dose? Locally, I mean?
We don't have that number right now. We just were working on getting some of the background work. So this morning we actually confirmed that we would be able to open it up tomorrow. And as you know, you may be aware that our bookings are through the health card number. So we actually, in the background, the work that gets accomplished is making sure the people that received their first doses within that time period, we upload their health card number so they're able to be successfully book their second dose. So that is happening today, and as of 8 a.m. in the morning, everything should be, accessible for people to start booking.
Thank you. And Dr. Ahmed, earlier in the week, you mentioned that you feel comfortable with the region moving toward the phase 2 of the province's plan. With the current rates in the community right now, how would you feel if the border were open for, day-to-day travel?
So border is another issue, and as I touched on it, that Windsor-Essex is not necessarily an isolated community, that we won't be impacted by the travel of people either coming in or people going out and then coming back in. So it would have an impact on our community. What we know at this time, looking at across the border, and more specifically the city of Detroit, they don't have the same level of coverage that we have with respect to our people who are vaccinated. So from a risk perspective, any potential acquisition could happen given the low vaccination rate and some of the transmission that's possible. So that will increase the risk if the borders are opened for at this time. And similarly, if we move forward while the rest of the province is still struggling with the Delta variant and with a higher case rate, that would still pose more problem for our region, because for two reasons. One is maybe people will choose to come to our region because they will say, well, this region has less cases and more or less restrictions, and let's just come here and party here, which would pose more problem for us. Similarly, if people are going outside of Windsor-Essex and then potentially exposed to some of these cases and coming back, it will put our region at risk. So it's tricky in terms of finding that balance. As a region on its own, yes, we are doing great, but I think the border would still be early, and we'll have to be careful in who this border is opened up. If it's opened up for people who are fully vaccinated, that's a different issue compared to border completely open for whoever is coming in.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Just looking at some data on the Health Unit's website, it appears that roughly 60,000 people were vaccinated with first doses between April 18th and May 9th. And I know that not everybody vaccinated up until April 18th has booked a second dose appointment yet. So with this flood of thousands of people being eligible tomorrow, what is your advice to people who may not secure an appointment right away?
So I'll start, and maybe I'll just pass it on to Teresa to comment as well. So your best option is always to use the online system, because then if you have access to computer and if you're able to book the system, please use that. If you're calling in, they also use the same system. You won't get ahead of the queue. In fact, when you're waiting in line, you may get, your wait time could be longer than what you could see in terms of using the online booking system on your own. So leave the phone line system for people who either do not have access to computer or who do not know how to book the computer. So leave those for those people, and anyone who is able to use the online booking system. And again, we are getting plenty of vaccine. So make sure that, don't freak out, even if you can't book the appointment right away. There will be plenty of vaccine. There will be plenty of opportunity, not just the mass vaccination clinic. You will have access through your pharmacy. You will have access to your primary care providers. So do not panic. Just be patient, and everyone will get the vaccine. I don't know, Teresa, if you want to add more to it.
No, I think that was well said. Be patient. We do have the call center is there to help people, and we know that Windsor Regional, the City of Windsor, and our health unit are all supporting the call center, and that they have increased staff if needed. But again, it'll be the waiting and being patient, and opening up just a couple days before the province will give people the ability to plan a little bit. But as we've done with every other opportunity for vaccination, we've tried to respond to any gaps in our booking or and open up the system for people, so they'll be able to get their vaccination, and it might be a little testing of their patience tomorrow, but I would say tomorrow doesn't have to be the day you go online and book. It'll still be there every other day moving forward.
Separately, how does it feel seeing the numbers that you presented today? 56 active cases and ever climbing second dose vaccination rate. These are good signs. So how are you feeling right now?
Oh, I was just not sure what the camera was. I'll start. It was great. So seeing 56, and you're exactly right. So the number 4, it can change. It can go up or down. But I know, like, we have meetings every day about outbreaks, what we're seeing, what we're seeing with the variants, what's happening in our community. And all week, we've been really positive and saying, wow, the outbreaks are, the rescind notices are going, they're happening. Like, these outbreaks are getting finished, and to see 56 is pretty significant. So it's a great feeling and a testament to all the work our community are doing and adhering to guidelines. And I don't know if we say it enough, but being vaccinated is great, and then waiting those 14 days. So you get I'm in my waiting period right now, waiting to be 14 days for my second shot, and making sure that I adhere to all the public health measures. And I know I'm probably very, very cautious, but I think we've all done our part to come to this point, and I hope it continues.
Doctor, how are you feeling?
I'm feeling that by the time Teresa retires from here, I want to share the good news that, Teresa, your community is in good hands, so you can relax when you retire. So great feeling all along, and even taking that extra effort to even comment that our region is ready to open up. I think that's again success and a testament to what is happening in the community. So definitely great feeling. I was hoping that maybe it would be less than 50, but our active cases, it's slightly over 50, so not the milestone that that I was looking for. But maybe in the next couple of days we will achieve that. And again, that would be a testament to the ongoing effort of the community. And I can't say enough about our community, that how we handle the third wave. I think this has been amazing, and we have been lucky with everything that we have seen. We were able to even support our community. We are in a better position, so let's just keep it that way. And I think that's the critical message, and Teresa said that exactly the same, that we are in a better position for what we were doing. So please keep doing what you're doing, and take precautions when it's needed, and at the right time we'll be communicating that, we don't need to follow, or we don't need to restrict you from one particular event or one particular thing that you like to do. I want to say that to the community, so as much as others are experiencing, and especially for some of the businesses, I do feel their concerns, I do feel their pain, and especially I would like to identify one particular industry, the personal service settings, the hairdressers, hair salons, and all those people. They have been they're not working at this time, and as we continue to show some progress, and they have to wait until stage 2, which is kind of something that is bothering them. It's bothering me as well. I need a haircut too, but and again, even from just a community perspective, I think I feel their pain, and we need to move forward with all these positive indicators, and try to move along the rest of the community, keep the vaccination going, keep the good work of keeping the cases down in our community. So I'm really excited, really happy, looking forward to continued success of our efforts in the region.
And separately, I'd like to talk about the consumption and treatment services locations announced yesterday, the potential sites. It seems to have been a long road to get to this point. So can you comment on being able to finally share those potential locations with the community?
That's another good story for us. As you know, we have been working on this for the last couple of years, and we initially did the overall community consultation, and looking at our numbers, things have gotten worse, and so it's unfortunate we don't have a site already, but we're going to move ahead. The plans are to get the consultation done based on the fact that we have disclosed the 2 potential locations. Even getting to the point where we are able to have suitable locations in our community was a lot of hard work, but that's all done, and now we do ask the community to weigh in on these sites, give their opinion, voice any concerns they have. We want to hear from you. It is part of the whole application process, and you do have a say. And so our work right now for the next month, this is July, and month of July, and into probably into August, is to get the feedback from our residents, our stakeholders, our businesses, from people about the 2 locations.
And just
Is the location? Oh, sorry. Go ahead, Doctor.
Yeah, just to add on to what Teresa's point is, and I think it's important that the community understand that this is one of an important tool to fight against the opioid epidemic that we are seeing. We have seen many people lost their lives as a result of opioid overdose. The COVID pandemic obviously has impacted this particular group more than the others. So while you think about completing the survey, think about the potential impact that it has in our community, and don't see that as one of the things that it's as sometimes people think that it's encouraging their behavior. It's not. It's the range of tool that we always talk about, from a prevention, treatment, education, as well as harm reduction and enforcement tool. So this is an important tool for people who are not there yet for medical reason, for mental health reason, or for any other reason to quit their addiction. So this is an area where we will bring in all these services together to help these people. We'll make sure that they have access to all the treatment and support that they need. So Teresa has done an excellent job in the last year, despite managing the pandemic, but also making sure that the work on the CTS application goes on. So those who are filling those applications, please note that this is an important thing for our community, but we like to hear your thoughts and your concerns. And I don't want to say more, but just wanted to make sure that at least the community see that this is an important thing for our community, and I fully support it. The public health has always been front and center for this opioid related deaths in our community and the impact of opioid in our community.
Is the location at 628 Guayo currently occupied by a business?
There could be a business there, like we did see it, but I don't know what the operation is right now, but it is available, so, I don't know really what kind of business it was.
Okay, thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Okay.
Any additional questions from CFTV?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yeah, from one more, sorry to keep this going, but can you comment on the jail outbreak being rescinded, and do you know how many cases were involved throughout that outbreak?
So that's a good question. So I'll answer to the first question while I try to find the answer for the second question. So yes, it took us some time to rescind the outbreak in the Southwest Detention Center, and partly because of the way all of these cases are reported and the testing protocol. So that means any new inmate that are coming into the detention center, and if they're tested and if they come back positive, and if they cannot identify any source of acquisition, which could have been outside of before even they arrive, so that leave that question mark whether this person acquired COVID in that facility or maybe acquisition was outside. So it took us a little bit longer to clarify all of those details, ensuring that all those measures are in place to provide the to guide the outbreak and rescind it. So at the end of the day, we were able to rescind. I don't have a final number. I think the total case count was still not high. I believe it was total of 16 cases that we have seen at the detention center, including both the staff and the inmates.
16's great.
Thank you.
Thank you, everyone. Have a great weekend.